Germ theory changed the world. It gave us vaccinations, antibiotics, and sanitation tools to help us fight even some of the history's deadly diseases. But what happens when we rely on it too much? While germ theory has definitely saved countless lives, its singular focus on pathogens has sometimes overshadowed other critical factors, such as the pursuit of health or a healthy lifestyle or even a healthy environment. So, in today's video, we're going to discuss the strengths of germ theory, its role in eradicating diseases and revolutionizing public health, but we'll also discuss its limitations, including antibiotic resistance, chronic disease, and the neglect of holistic approaches to health. But first, if you are new to my channel, welcome. My name is Dr. Erica Steele. I'm a board certified naturopathic doctor with 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school so you don't have to. If you are interested in learning about how you can practice a holistic lifestyle that's healthy and effective and helps prevent disease rather than just simply react to it, please join our free community. There's a link below. We discuss, there's Jumpstart, there's all kinds of resources available for you that are completely free, and you can learn how you can implement a holistic lifestyle today. All right, so now that we've discussed that, as we discussed in our last video, germ theory really was championed by Louis Pasteur and Robert Koch, who linked very specific microbes to specific diseases. Its clarity and success made it a dominant in the medical model, and also too, conventional medicine really has gripped onto it and they utilize it to this day. But there's a lot more to the story that I think doesn't meet the eye and a lot of people are unaware of because we have superiority bias and confirmation bias, meaning that we only believe that there is one way, conventional trained Western med, germ theory, that is the only way the disease process is developed. However, there's a lot of shortcomings. So let's first talk about the strengths. So the strengths are revolutionized medicine and public health. Germ theory transformed how we really treat diseases. And here are some of the few successes. So smallpox eradication. Smallpox was once a deadly disease in human history, but thanks to sanitation practices, as well as eventually smallpox vaccine that developed based off of these theories, this disease was declared eradicated in 1980, which was a victory in global health. Recognize that it was combined with sanitation and also the inoculations that contributed to that. It wasn't the inoculation in and of itself. So polio and cholera, these are definitely widely known. Again, sanitation and not bathing in our own feces and getting indoor plumbing really contributed to the assistance in eradicating these diseases. Later on, vaccination campaigns for polio nearly eliminated the disease worldwide. But again, we looked at the improvements of water sanitation, which helped control cholera, and then that was much major killer in the 19th century. And then again, later on, vaccinations came into focus. It's important to know that the thing, like with Koch, they identified the microbes, that were causing it, and then reduced sanitation or increased sanitation practice, so reduced the spread, and then through, the laboratory processes, created inoculations for future exposures. So there also too was a lot of advancements in surgery. So before germ theory, surgery was pretty risky. Infection was pretty much guaranteed. Pasteur's discoveries led to sterilization techniques like boiling instruments and washing hands. Then we'll talk about Joseph Lister, who also pioneered antiseptic surgery by applying carbolic acid to sterilize surgical tools and as well as wounds. He drastically reduced our surgical mortality rates. While there still are infections like MRSA and opportunistic infections, when you get surgery, definitely it's eradicated, and infection control is always a huge concern in a public health setting. Public health campaigns where germ theory revolutionized our campaigns led to life-saving practices that we take for granted today. Definitely, we've seen through COVID, hand washing was promoted, but also figures in the past later really focused on validating the germ theory through these sanitation practices, such as hand washing. Improvements in sewer systems, as well as clean water supplies, also directly reduced infection disease outbreaks. Vaccinations really became the cornerstone of prevention in germ theory. But again, vaccination is not always available for everybody and isn't always recommended for everybody based off of medical or religious or philosophical reasons. So here's some of the differences in germ theory. So there's over reliance on drugs and vaccinations. While antibiotics and vaccinations are helpful, their over reliance on them really gives us false sense of security. And it's also created a lot of new challenges. Not to mention antibiotic resistance. Antibiotics are given just about everything. And while they did help revolutionize medicine, their overuse has led to a lot of antibiotic resistant bacteria and superbugs that are becoming more difficult to treat. MRSA and is definitely one of those things. I know in my public health degree, I did a whole paper on MRSA and how to reduce MRSA outbreaks in hospitals. So it's definitely a challenge. And as we continue to use antibiotics, these little microbes are just going to continue to replicate. There's also a lot of vaccine hesitancy and overprescription of vaccinations and a lack of clarity in understanding of any sort of risk factors. These kind of blanketed statements saying that it's safe and effective for everyone can be pretty misleading when there's really no medical treatment that's a safe and effective for everyone. Also, too, having over reliance on vaccination programs also overshadows some methods, such as improving your immunity, like nutrition or lifestyle changes. I know through COVID, where I was doing a lot of public health education, I didn't really see the mainstream media talking about supplementation of, let's say, vitamin C or zinc, or even just increasing your protein, increasing water as methods to keep your immune system strong. In my practice, because we take a lot of personal data, during the pandemic, we were able to close our practice, do full cleaning of our practice, because remember when I was living on services. And we also, in addition to that, were able to run reports and contact all of those patients who are most susceptible, either with their immune system or their cardiovascular system or their lungs. And because of that, we were really successful in not only not losing patients, but also helping keep patients healthy and safe during the pandemic. Germ theories focus really on the external environment, and it's often caused health systems to ignore the internal terrain. So things like diet, stress, environment, while they may be spoken about, there's not a lot of direct actionable items in conventional medicine because that's just not their practice. Chronic diseases like diabetes, heart disease, and autoimmune are not caused by germs. They're caused by poor diet, stress, environmental toxins, and sedentary lifestyles. So there's a lot of limitations in practice when there's not a whole lot of tools other than, let's say, we'll watch it. Active surveillance is oftentimes what's recommended in those cases, or even really harsh treatments that may or may not be effective. The success of germ theory encouraged a hyper specialized approach to medicine. So doctors focus mainly, conventional doctors anyway, focus mainly on treating symptoms and infection, but they really miss the bigger picture of holistic health, and they're not trained in that. Instead, they're trained in diagnosing, looking for symptoms, labeling that, and then managing it with a pharmaceutical, a procedure, or a surgical intervention. So, what if instead of waiting for disease to strike, we actually focused on building the mind, building the body, and building resilience enough to prevent it in the first place? After all, they always say, what is a pound of prevention is worth, I think, an ounce of cure or something like that. And so, making sure that you're practically every single day focusing on healthy goals. So, what are healthy goals? Hydration, eating your protein, making sure you're spending time outside or meditating, working on your mental health. These are all really practical things that you can work on to prevent diseases from happening. Having proper sanitation practices, having proper food handling practices. These are all things that help strengthen our immune system while also reducing the possibility of infection and keeping infection control, especially during those cold winter months when bacteria are just swirling around and a lot of times people's immune systems are compromised. Typically around like that October, September timeframe, really when the weather is kind of in that fall transitionary period, is an excellent time to begin strengthening your immune system if you haven't been doing that already. So in conclusion, germ theory, while it did transform public health, eradicating things like smallpox, giving us vaccinations, antibiotics, and modern sanitation practices, and in essence, saving millions of lives, we want to understand it's not the whole story. This overemphasis and this oversimplification that pathogens are the only thing has led to many blind spots, including the rise of antibiotic resistance, chronic lifestyle related diseases such as hypertension, diabetes, kidney disease, all of these things, because conventional practice neglects lifestyle and environmental factors. The belief system is these kind of things just happen. There's no real causative to them, when in fact we know that if you start to build your health with proper diet, with proper water, exercise, nutrition, these are all factors that your immune system is going to help use and strengthen. In fact, I don't know the exact study, but in Israel, during the COVID inoculations, they did a pretty broad study. It was a pretty big study that they did. I think it was like 30,000 people. And they followed those people who had inoculated and those people who had not inoculated. And they discovered actually that the people that had natural immunity, that had developed, that had gotten COVID themselves, and then their bodies actually built antibodies naturally, their immune systems were much stronger in the fight against opportunistic disease. So COVID is not the only virus, and it's replicated and continues to replicate, and various different viruses are still around. But working on building not only our internal environment, but also accessing conventional methods like sanitation and keeping all of the bugs down can really help us. So now let's transition to this terrain theory, the perspective and focus on creating an internal environment to prevent this disease. In our next video, we'll really get into deeper into the terrain theory, and we'll explore how the terrain theory complements the germ theory, offering more of a holistic approach to health and healing. Again, if you want to know practical, if you cannot wait till the next video, if you want practical information, please join the community. We have lots of jump starts. Also, my app is available for free in there. There's lots of links. You can book a discovery call if you need more expert guidance. But I provided a really good jumpstart plan for you to begin to be more proactive instead of reactive with your health. If you found today's video thought-provoking, go ahead and smash that button, that like button, subscribe so you don't miss the next one. And let me know in the comments, what do you think are the greatest successes and limitations of the germ theory?